What's up, everybody? It is the PA Professor back with another video. Today we're going to be covering the topic of atrial flutter. This is another cardiac arrhythmia. It's not as common as atrial fibrillation, and it's not as high yield as atrial fibrillation, but I can almost guarantee you will see at least one question on atrial flutter on one of your exams, whether it's your PANCE, EORE, or your end of didactic or your EOC exam. So let's begin. If you know nothing about atrial flutter, just read and interpret. Atrial pertains to the atria of the heart, and then flutter just means like a motion, like fluttering or quivering, almost like atrial fibrillation. So you have something along the lines of the atria is fluttering, and this is due to a cardiac arrhythmia. So my definition of atrial flutter is this is an arrhythmia that comes from a singular ectopic foci. If we remember, we talked about atrial fibrillation being multi-ectopic foci. So there's multiple ectopic foci in atrial fibrillation firing, but in a flutter, there's just a singular ectopic foci firing, and this will mean more, and you'll understand it better when we go over the EKG in the workup section. But because we have this singular ectopic foci firing and it's not of the SA node, right, it leads to just this fluttering atria. Because we don't have the pacemaker of the heart, the SA node, generating that first impulse, we don't get the correct atrial contraction, and we just get this flutter. The big deal about this is, just like atrial fibrillation, and I should have this in red right here, but I don't. But since we just have the atria fluttering, it's not dispersing all of the blood into the ventricle, and you get this stagnant blood, and that leads to an increased risk of thrombus formation. So I didn't write it down right here, but just make a note of that. In atrial flutter, you have the same risk of blood clots, just like atrial fibrillation, because you have the atria are just fluttering, right? And then you have this possibility of lower cardiac output because we're not squeezing all the way, basically, and you're not getting the correct amount of blood flow to the ventricles, so it can lead to lower cardiac output symptoms. So etiology for a flutter, it's not really high yield, but from what I've read, people with hypertension and coronary artery disease are most likely to have this. In my mind, I just see it kind of like AFib. You know, if this atria gets injured, if it's pumping and gets a big afterload, you have backup stretching, injury, and fibrosis from an MI, that's kind of what I think of. But this is not super high yield. You do need to know this definition, though. So symptoms, just like AFib, because we're in an arrhythmia, we can have these palpitations, right? And then because we could possibly have lower cardiac output with a flutter, you can have these pre-syncopal, syncopal episodes and dizziness. This should make sense. So our workup, here's the EKG. Let's go over this real quick. This is the most high yield thing you must know about a flutter. You have to know this. 95% of your questions on a flutter will have this in it. So this person comes in, right? You have a vignette. This person comes in with palpitations. You do an EKG, and let's say the EKG reads out you have sawtooth-like P waves. Well, what does that mean? So if you look down here, these P waves, they look like teeth, right? Kind of like a saw. So this is what that means, a sawtooth-like P wave. And you see how these P waves, they look just like each other, right? And that's because it's all coming from a singular ectopic foci. If you remember in atrial fibrillation, you have multiple ectopic foci firing, and that's why all those little quiver lines, that they're not P waves, but they kind of look like little different P waves, but they all look different, and that's because it's multiple ectopic foci. It's not the same one firing like in a flutter. So that's one way we can distinguish a flutter from AFib, is you have this sawtooth-like P wave, and they all look the same. Another way we can differentiate a flutter from AFib is regular R to R interval. Remember in AFib, there was everything was random. It was irregularly irregular, correct? So these R waves in a flutter are regular. Look, they're the same distance apart. That's regular. Where in AFib, this one would be right here, there'd be one right here, then there would be one all the way over here. It's totally random in AFib. But in a flutter, it's regular. Again, you can do, like we said, on the definition slide, you have an increase of thrombus because you're not squeezing, right? You're just, the atria is fluttering. And so you can do an echo to see that blood clot in the atria. However, this is not as high yield for a flutter as it is for AFib, and that's because AFib is much more common. So, treatment. And I should have done this with the atrial fibrillation, but we'll kind of talk about them side by side here. So first, for both of those arrhythmias, is your patient stable or is your patient unstable? Let's go with stable. So say this person presents to the emergency department for palpitations. They think they're having a heart attack. You do an EKG and you see a flutter. Well, what's their blood pressure? Are they stable or do they not look so good? If they are stable, right, you still want to get control of that arrhythmia. And you do that by using a beta blocker, which also works on the AV node. It's an AV node blocker. And so what happens is when this arrhythmia goes on, this singular ectopic foci fires, and it basically makes this re-entry circuit kit where it just boom, boom, fires, and every, 3 gets through that AV node. Well, with treatment, you want to still treat the arrhythmia by kind of hindering those signals every time from going through the AV node. And what do you do that with? A beta blocker or a non-dihydropyridine calcium channel blocker. So, are they stable? Yes, use some sort of medicine, right? If they're unstable, their BP's 80/50, they don't look so good, you want to get them out of that arrhythmia faster, and you want to cardiovert them, right? You want to synchronized cardiovert them. And then if you have, if you're treating refractory chronic A-flutter, they have this procedure called the catheter ablation, and what that is, they stick a catheter up your venous system, and they basically ablate or burn off that singular ectopic foci firing, hopefully ending that arrhythmia for good. And then, like we said, should we use anticoagulation with this atrial flutter? Probably, right? Especially if they have risk factors. Well, what score do you think we'll use? Just like in AFib, you can use this CHA2DS2-VASc score to determine your patient's risk for stroke with a flutter and AFib. So, with that being said, let's do a high-yield vignette question. And I've realized I've been using a Y on vignette. That's my Kentucky brain of mine. It's really spelled with a G, but whatever. So, a 73-year-old female with a history of coronary artery disease presents to the emergency department with palpitations and shortness of breath. So, you want to get an EKG, right? The initial EKG shows regular R to R intervals. That automatically rules out AFib, right? Because this first sentence, you can be thinking, this is an arrhythmia. Could it be AFib? Could it be A-flutter? But this next sentence, when it says it has a regular R to R interval, that automatically throws out AFib. And then it says, and sawtooth-like P waves. Remember, first, we don't even have P waves in AFib. And then this sawtooth, that's like a buzzword, right? This sawtooth-like P waves, that is pathognomonic for, a flutter. So, the question asks, what best describes the arrhythmia present? So, we know it's talking about a flutter, so now it's just asking, what's the description of a flutter? What's going on? What's the patho? Well, if you remember, this is a singular ectopic foci firing uncontrollably. And I kind of talked about that singular re-entry circuit in the workup section, but really this is your patho. It's a single ectopic foci firing uncontrollably. And remember, if it was AFib, it would be multiple ectopic foci firing uncontrollably. So guys, that is a flutter. If you like this video, give it a like. If you haven't subscribed already, subscribe to the channel. We're going to be posting hopefully every day. Thank you guys for watching. Good luck on all your boards and all your exams. You're going to do great, and we'll see you in the next video.